I think after the election, you would see some movement on the healthcare reform there. And in fact, I take this opportunity to applaud Commissioner Cheney. He understands it. He got it. But they don't want to let him keep it. They switched him and told him that he can't do the healthcare transfer until after the election. And that would take in some 270 of working uninsured Mississippi. Working uninsured. And I'm not going to talk about McDonald's because we're at our own state capital. You'd be surprised at the number of employees we got in this state that makes minimum wage. That's your working uninsured. You know how they take care of their children? Through CHIP. And some are beginning to qualify for Medicaid. But this will take care of the adults. Exchange. About 270 people working poor in Mississippi. Working poor in Mississippi. I didn't say working poor in the Delta. I said working poor in Mississippi. And then you tell me that they say that we should not expand Medicaid because that is almost $10 billion over 3 years, and as I understand it, it's 100% funding of Medicaid, the new recipient. There's some 200,000 that'll be left, 400 if they don't choose to, that can be utilized in bringing in the health care for 100%, and then I think it's a step down, depending on who you ask about the affordable health, for the next years to come. And that's 3 years out. Now I'm going to make a prediction right here. Because the last time I witnessed governors said they were going to expand Medicare, both of them expanded Medicaid in my lifetime. Well, one of them was in my lifetime, and that was Governor Barber. In fact, he called a special session within a special session. And the other one was John Bell Wheaton that called a special session. I bet everything I got except my boots. I don't bet my boots because I love it. But I bet anything else that I got, that they expand Medicaid before the next elections of a governor or a lieutenant governor, or they're going to lose the House or the Senate back to the Democrats. You can't have 400,000 people in a state with 2-point-some million people and underfund 400,000 people. I don't understand the logic behind it, but you can't do that. Because if you just use a factorial, is that right? I think we did that in math where you multiply it out 400 times, and you do it like that. That means that you would have probably more than half the population underserved. Now, this is what the fight is, and you're going to get it. You cannot, we cannot afford not to, because this is the fight and this is the challenge, my friend. How are you going to stop 400,000 people from going into emergency room? Because the law says that in order to receive Medicaid, there's a thing called HIP. You must receive a patient in the Medicaid in an emergency room, and then you must stabilize that patient. You can't dump them and send them to the next hospital, which is the University Medical Center. Well, the University Medical Center already served about $800 million worth of undercare compensation last year. That's about $80-some million worth of worth of undercompensated care. And then look at all the hospitals. Now, in the affordable thing that the Supreme Court did not strike out is what you call the dish payment. This portion of share payment, which allows hospitals to get tax credit for serving under compensated care patients. It goes away